If you are a colleague out there that is struggling with the admission policies and practices you have in place, you are not alone. Welcome back to Dr. Sellars Educate, where our mission is to support all nurse educators that are on the journey to achieve certification, maintain certification, or to become a better nurse educator. Our goal as a nurse educator is to equip our nursing students with the expertise they need in order to make safe patient care decisions when they graduate, as well as to engage in application and analysis, those upper to mid levels for Bloom's taxonomy in the cognitive learning domain when it comes to the didactic setting. So making sure we integrate and truly bridge and close those theory practice gaps that many nursing students experience when they're in the didactic setting. Patricia Benner's novice to expert model really sends a call to action for all of us as nurse educators to make sure we're not separating that didactic from the clinical experience. We want to be able to bring those together to best support student success in the classroom, success in the clinical, and success in the lab and STEM area. All right, so first and foremost, we want you to pull out your resources. All right, so we're starting a little different in this snapshot. You're going to print out the study worksheet that is listed right here in the description. Second step, we want you to pull out Billings and Halstead. All right, so the sixth edition, we're going to go ahead and give you the page numbers for the sixth edition. That is going to be, and this is the sixth edition, by the way. So for the sixth edition, when you look at the diverse learner, you're going to focus on pages 22 through 24, okay? And then if you have the seventh edition, which is this one, you're going to focus on pages 108 through 110, okay? So diverse resources for curriculum development, page 108 through 110 in the seventh edition. And in the sixth edition, when it comes page 104 in the sixth edition. Okay, so why do we give you page numbers? Great question. When you're moving forward on your journey to C&E or to become a better nurse educator, we don't want you wasting time. Okay, so that's why we're focused by looking at and reading content that's on those specific pages to help you close your knowledge gaps. Okay, so number one, printing out the study worksheet. Number two, pulling out your Billings and Halstead Teaching and Nursing sixth or seventh edition. Third step is to identify what is it that you want to walk away with having a better understanding about at the end of our time together today. Okay, so speaking of today, what is it that we're focusing on? We're talking about how do we enhance nursing practice through curriculum alignment. Okay, so these are some specific strategies that are going to help you improve student success rates in your nursing program. And how many of us could benefit from that? Yes, I think we all can. So, what are going to be some of those strategies that you're going to use to help you enhance the learning experience with your students? First of all, we're going to think about matching the nursing practice with the education. It's going to help our students really make sense of the experiences that we're outlining for them in the didactic setting as well as in the classroom setting. So, first and foremost, how are we engaging and enhancing students in that learning process as we think about how to bridge that theory practice gap? All right, so then our second focus is looking at our actual admission policies. So, first of all, what's the criteria? What is the GPA? What other HESI or admissions testing is required? What are those barriers to admission? Is our GPA too high? Is it too low? Okay. What are some of those contributing factors that we know are not helping our students? How can we make a better decision about what those admission criteria are to help decrease those barriers and increase student success once they get in the program? All right. The next focus area is going to be the goals related to our policy. So go ahead and think about right now, just looking at those two indicators, how do we want to revise our policy to make, I would say, better informed decisions about our admission criteria? The nursing program, our goal is to implement changes that will not only improve student admission rates, but also ensure a more diverse cohort that will positively impact clinical outcomes. Now, why is that important? All right, I want you to think about that. Why is it important that we have a discussion about diversity in our student population? I want you to consider the number one reason is so we can better provide quality patient care. We know that patients and families feel more comfortable when they see caregivers that look like them. So we want to make sure when we're thinking about creating an inclusive and holistic admissions process that we are considering this factor. We still want our benchmarks to be set at where they are, but we want to consider different elements associated with the admissions processes that we are using. Okay, so we want to think about that because it's all about how we can best support the needs of our patients. Next is to look at those barriers that many of our non traditional students face when it comes to admissions. And this is the other consideration. We want to focus on the data. So the data should inform our decisions. What does the data tell us about students that we admit and aligning that with how they actually perform in our nursing program? So look at the data within your nursing program, and I highly encourage you to publish that data to engage in a higher level of scholarship with your colleagues across the country. Okay, so we want to share any best practices that we are discovering as we look at ways to not only make better informed decisions about the students we're admitting, but what are those contributing factors that's keeping students in our program? The next consideration when we think about barriers that are faced by our students is to consider how we are preparing our students and supporting them through each phase of the admission process. Okay, so year one, we know that data tells us that we can see an increase in our persistence rates up to 30%, 30, that's a lot, when students have tutoring and mentoring programs. And then year two, what about enhancing those clinical simulation experiences, introducing them in year two? Now, this is designed for a 3-year program, but you may have a 4-year program. And so what you want to consider is what does that look like for your students? Maybe that first year is pre-nursing. So how can we go ahead and better engage our students, even from a pre-nursing standpoint? There are strategies that we can put in place, such as helping students how to study. Okay. Second of all, helping students with test taking strategies. Many students of color have challenges when it comes to test taking anxiety. Okay, so how do we help them manage that and deal with that early on in the program? So by the time they get to year one or year two and the upper level courses in nursing, they would have already developed some strategies to help them stay in the nursing program. All right, so that's year two. And then year three, it's that ongoing evaluation. Think more about that formative feedback, partnering with our students to help them shape and really reframe their clinical practices to better align with what the evidence says. Not only is this going to help students in clinical practice, but it will also help our students on exams, because we know many of our questions when we look at our blueprint are at that application analysis level, those mid to upper levels on Bloom's taxonomy. Taking a look in the 6th edition on pages 188 through 190. Okay, and then in the 7th edition, if that's the edition you have, then you're going to take a look at those specific domains as it is outlined in chapter 3. All right, so I'm going to go there with you and make sure it's in chapter 3, because it is a little different. Oh no, it's in chapter 10 actually. So 7th edition is page 217. That's where you're going to find all 3 of the learning domains, pages 188 through 190 in the 6th edition. All right, so that's year 3. That's how we're going to best support our student, is by thinking about the different levels of learning that we're validating and evaluating, and how we can best support students that may be struggling. Finally, what are some of the benefits, right? So, what is the why in creating these inclusive admissions policies? I'm glad you asked. Research tells us when we have more inclusive policies related to diversity and when it comes to creating better patient outcomes, that's exactly what happens. When we're enhancing our diversity, we welcome a broad range of applicants. We also improve retention rates because students can appreciate each other's differences, and it ultimately leads to better outcomes, just like what we talked about. What our students realize is that they are more alike than different. And this is the other benefit of creating diverse student populations in our programs. Students learn how to work with each other, right? Other people that are different, maybe, than what they are, and maybe even those that they've been around for most of their life. And that's what's going to happen when they become a nurse. So let's help them understand how to work with diverse students that have different beliefs and different backgrounds. All right, and then as we wrap up, you want to consider not only the inclusive admissions policies, but what are some of those sacred cows, we like to call them in nursing? Well, we have those also in our admissions policy. So, what are some of those, and how do we get through them? When we're thinking about strategies to best support our students, it takes collaborative efforts, it takes collaborative thought. So I encourage you to even inquire with your students about the admissions process, the retention programs, as well as the graduation requirements. We want to gather feedback either from data, from a quantitative or from a qualitative standpoint to help improve our admission processes, our retention processes, as well as our graduation policies. Our goal in nursing education is to equip nursing students with the expertise they need, not only to be a really good nurse, but to be a future nurse educator that is going to role model these evidence based practices, and a future nurse leader that is going to transform their clinical environment to help support the consistent delivery of quality care. We hope this snapshot has been helpful. We look forward to seeing you in our next snapshot. DrSellarseducate.com is where you're going to find all of our resources. Info at DrSellarseducate.com. You can send us an email there with any questions you have. Thank you for joining us, and we look forward to seeing you in the future. Have a great one, everybody.